We're going to be talking about personality. And personality in psychology are our attitudes, emotions, thoughts, habits, impulses, and behaviors that define how we typically behave. We'll start with the psychoanalytic approach. So, this posits that personality is a product of unconscious forces or desires and our early childhood experiences. So, psychoanalytic theory starts with Freud, and he posits that we have different levels of awareness, three to be exact: conscious, preconscious, and unconscious. The conscious level of awareness are these thoughts, impulses, and urges we have that we're completely aware of and know why we're doing them. Preconscious is like this holding space for accessible thoughts, impulses, and memories. And it's a place where we can become aware of something. So it's kind of similar to working or short term memory, but it also is all we can be aware of, but not aware of yet. It's a little bit ambiguous in that sense. And then we have our unconscious, which are inaccessible thoughts, impulses, memories, and behaviors that we're not aware of. So, all levels of awareness influence our behaviors. We know we can consciously choose to do or not to do things, and we sometimes have moments where we don't know why we did something. For example, a couple could argue and admit they consciously said something mean to intentionally get back at each other. Other times, they don't know why they said something mean, and come to find out they unconsciously act out what they saw their parents do when fighting, or maybe in this instance, they're trying to feel seen and heard in a way that they've never been understood before. In this sense, though, we can think back to attachment theory, where we see how many of us behave in ways that are trying to fulfill unconscious needs and desires. So, Freud also says we not only have levels of consciousness, but we also have a structure to our personality that also operates on different levels of consciousness. It first starts with the id. So, this is the unconscious personality, or the part of our personality we're unaware of, that is seeking pleasure and gratification. And the id operates on this pleasure principle where it's trying to maximize pleasure and gratification while avoiding pain. We then have the ego, which is the preconscious and conscious personality. So the part of our personality we have yet to be aware of or can be aware of, and the part that we are actively aware of. And that is attempting to meet the id's demands of pleasure and gratification. But the ego operates on what we call the reality principle, where it's trying to find socially appropriate ways to fulfill certain desires and demands. And then we have our superego. So this is personality that is aligned with our sense of morality. And it can be unconscious, preconscious, or conscious. So it operates on all three levels. Now, the demands of the id and the ego are usually in conflict, and we call this intrapsychic conflict. So the ego, a lot of times, the one that's trying to find those appropriate means to fulfill desires and demands, will actually engage in a lot of defense or coping mechanisms to reduce any sort of negative emotions or distress that arise from the conflict it has with the id. Sometimes we'll rationalize, justify, or try to make sense of what we do to reduce that distress, possibly. We also have an ideal self or ego ideal where we imagine how we ought to be. And a lot of times this will come from childhood experiences based on what we were praised for, told to achieve, punished for, and so forth. So an example of all of this put together is maybe you're in a relationship while trying to build an ideal career, in which both require your time and energy. You might conflict with how much time and energy you give to both because you're torn between a fulfilling relationship and personal ambitions. Your id is wanting you to seek pleasure and gratification, which you find in both. So your ego is trying to find a way to balance this, but might be leaning toward the career ambitions being the priority based on society deeming this type of ambition as socially acceptable and the top priority in life. But your superego, your morality, is helping to direct you in a morally right decision by reminding you, hey, you can do both and that your relationships are not forever and you don't want to be lonely. So now you are in a rather anxiety-induced space So you might try to justify and rationalize your decision in maybe spending more time in your career by telling yourself, I'll be able to provide for my partner and that's important, so the lost time is worth it. Or you figure out how to balance both, but then cope with the fact that both might not always be the ideal. Freud also said we have these psychosexual stages that additionally impact our personality. So he believed that personality develops through these stages, and they represent how pleasure will change over time and how our environment influences this. So the first stage is what he calls the oral stage, which is 18 months old, where your mouth is the center of erogenous pleasure, and it's influenced by feeding experiences. The anal stage is 18 months to 3 years, where gratification and pleasure arise from toilet or potty training. And this can lead to what we call anal retentiveness. So some people might be neat and stingy, or anal expulsions, where some people are categorized as sloppy or excessive, depending on how this stage goes. We then have the phallic stage, so 3 years to 6 years, and you're learning the importance of genitals. So he has what we call the Oedipus complex. So males supposedly experience an unconscious sexual urge for their mother, where females have the Electra complex. They experience an unconscious sexual urge for the father. Latency stage is 6 years to puberty, and that's where sexual impulses start to get pushed to the background, and the focus is placed a lot more on your environmental demands and needs. And then there's the genital stage in puberty, where sexual energy comes back and is directed towards your peers. Now, he says that going from one stage to the next requires the right amount of gratification, not too much or not too little, from your caregivers. So having too much gratification can make it difficult to move into the next stage due to hesitancy. Why move forward in life when everything is great? But too little makes it difficult because there's unmet needs. So it's why move forward when I still need something? With this, you can develop fixations where you move forward, but your personality remains stuck in a stage and you have underdeveloped parts of your personality. For example, if you do not complete the oral stage successfully, supposedly you might develop an oral fixation and smoke. Now, a lot of people piggybacked off of Freud, and we have what we call neo-Freudian theories for personality. And these individuals agreed with Freud, and they thought that the unconscious conflicts were important to understanding our personality, but they placed a lot less emphasis on the role of instinctual impulses of sex and aggression. And 3 main ones we'll look at are Carl Jung, Alfred Adler, and Karen Horney. So we'll start with Carl Jung, and he coined what we call the collective unconscious. So the collective unconscious is images, ideas from earliest development of the human psyche. In other words, it's this universally inherited unconscious part of the human mind that we all share and are predisposed to. But he also has what we call the personal unconscious. So these are forgotten memories and repressed experiences from our past, and they're very unique to each individual. So we have the collective, which is inherited, and the personal, which is based on our experiences. Now, part of the collective unconscious, though, are what we call archetypes. They're these mental representations, symbols, and predispositions we have to respond in certain ways. And we all supposedly have these archetypes. And some of the more common ones you hear about are anima, the female aspect of each person, the animus, the male aspect of each person. We have persona, so the character we assume when we relate to others, or it's who we present to the world, and shadow, negative qualities we try to hide. If you ever hear someone talk about their shadow selves, that's actually what they are referring to. Some of the other archetypes we notice could be sage, magician, lover, caregiver, jester, ruler, outlaw, and so forth. You'll usually hear archetypes referred to in different names, but a lot of the times they're referring to a similar aspect. But the reason I bring up the personal unconscious and the collective unconscious is because our archetypes can be influenced by both. So, for example, your inner jester could be something that naturally embraces humor. It's this inherited part of the collective unconscious. But because of personal experiences, maybe you've learned humor diffuses negative situations. Whereas maybe there's an inner lover that seeks intimacy and connection as part of collective unconscious, but because of your personal unconscious or unique experiences, it's being impacted by this deep-rooted fear of loneliness and rejection. So next we have Alfred Adler, who looks at the inferiority complex. He posits that personality develops from attempts to compensate for our feelings of being inferior. When we appropriately feel inferior, we can develop a sense of achievement and creative growth. So we're overcoming a sense of helplessness or a lack of knowledge by attempting to master something in our environment and learn. If there's a deep-rooted sense of being inferior, this can actually impede growth and development and cause that inferiority complex. So it's this persistent sense of inadequacy and insecurity that leads to low self-esteem and, more often than not, perfectionism at times. Birth order greatly impacts this because each sibling has a very different experience, but you commonly see the youngest sibling being the most coddled, the middle being forgotten, and the oldest having the most pressure to set examples and lead. So each is going to bring its own issues of inferiority in those cases. Next, we have Karen Horney, who looks at what she calls basic anxiety and culture. She did agree with Freud in that personality is impacted and develops through early childhood experiences, but she didn't like his belief that development came from a sense of instinctual conflict. Instead, she says we have basic anxiety, so feelings of helplessness that will develop in children from early familial relationships, and these family environments and disturbances are usually what causes this anxiety. So as children, we'll look to cope with this anxiety by pursuing prestige, love, power, detachment, and so forth. And culture will play a large role in personality development, more so than biology and instinct. So you actually see some of this to be true in adults with attachment issues. Based on the caregiving they received as a child, you'll see them develop attachments to others in some non-productive and maladaptive ways at times, when all they're trying to do is cope with certain anxieties to some degree. Next, we'll look at trait approach, so the consistency and sense of stability in our personality. Trait approach really describes personality according to our internal biological aspects that we call traits, or our tendencies to behave in a certain way. So first we'll take a look at Gordon Allport and trait theory. So he has what we call central traits, the foundation of our personalities that basically typify our usual behaviors. It's how you would behave in most situations, but not all. So by nature, you might be very friendly and talkative, or you are shyer and take time to warm up to people. There's what we call secondary traits, which are situational and less consistent and predictable. Maybe you're assertive at work, but in day-to-day life you aren't, and that's because work requires this assertiveness from you to be effective at your job. And then there's cardinal traits, behaviors across all situations, very basic and permanent traits, and they're these elements of our personalities. The only thing is cardinal traits are rather difficult to identify, and it's because of group conformity and environmental influence. So this trait isn't really believed to exist very much, but it is important to note that traits vary from person to person. So maybe what is a central trait to one person might actually be a secondary trait to another. We then have Raymond Cattell, who has the factor analytic trait theory. What he did is he used factor analysis, which is a statistical method to look at the relationships between observable variables, to look at the relationships among traits. So he identified 36 surface traits, which are basic traits describing our personality. But then he thought there must be traits accounting for these traits, which are 16 source traits he identified. And they're these very basic, broad, and universal traits that are the core of our personality. So another way to think of this is source traits are like the underlying building blocks of personality, while surface traits are the observable parts of your personality. For example, a source trait could be warmth, and this impacts your surface trait of how reserved or warm you are. Or perfectionism could be a source trait, and that can impact your surface trait of how undisciplined or precise you are. We now have Hans Eysenck, who has the PEN model, and the PEN model stands for psychoticism, extroversion, and neuroticism. And he says that based on these qualities, it will impact our personality. Now, everyone does have some of these traits, but maybe some of us tend to lean more predominantly towards others. Psychoticism, though, is tendencies towards recklessness, aggression, disregard for common sense, or maybe it's inconsideration of others and so forth. Now, psychoticism is not to be confused with psychosis, which is when you're losing touch with reality because of delusions or hallucinations. Psychoticism is a personality aspect, and if it's really out of hand, it typically becomes a risk factor for some mental health conditions because you'll notice things like aggression, impulsivity, unusual beliefs, or engagement in risk-taking behaviors like compulsive shoplifting. The key is that these behaviors are rather dangerous, causing issues in someone's life, so it's more just an early warning sign. But just because someone doesn't have common sense according to our opinions, or maybe they disregarded us or others, or they were just rude, it doesn't mean that they necessarily have all the characteristics of psychoticism. Now with extroversion, that refers to extroversion and introversion. So introversion is when energy is directed inward, and extroversion is classified as energy being directed outward. So people who are introverted might prefer time alone, as opposed to people who are extroverted might prefer time with others or out in a social setting. And then there's neuroticism, which looks at emotional stability. That's our ability to control and manage our emotions, where neuroticism's the degree of emotional instability we have. So we actually have this graph on the right-hand side to where you can use it to see what characteristics you identify with. So let's say you're introverted and you're pretty emotionally stable, then you would identify with the characteristics in the purple section. But if you're extroverted and slightly neurotic or emotionally unstable, you'd identify more with the characteristics in the yellow section. Another theory to explain personality is the 5-factor trait theory. So this says we have 5 core dimensions of personality, and they'll appear across all cultures. The first one is openness to new experiences. So this is the degree to which one is thoughtful and rational when considering new ideas and experiences. People high in this category tend to be imaginative, creative, curious, or prefer variety and novelty. And it's said that those who are low in openness to experience prefer routine, familiarity, and they're less likely to consider new ideas or try new things. We also have conscientiousness. Ooh, there's thunder outside. The degree to which one is aware of and attentive to other people, to the details of a task, or maybe to both. So people high in conscientiousness tend to be hardworking, ambitious, reliable, self-controlled, whereas individuals low on this dimension are more unreliable, lazy, and spontaneous. Then we have extroversion, which that talks about whether energy is directed inward or outward. People high in extroversion are called extroverts, and maybe they're talkative, sociable, and want to be around others. Where on the other end of the continuum, you have introverts. They're quiet, reserved, and much more comfortable on their own. We also have agreeableness, so that's the degree which one gets along well with others and acts unselfishly. Being easygoing, altruistic, and trusting are trait characteristics of someone who is high in agreeableness, where if someone's low in agreeableness, they're less concerned with other people, maybe they're unfriendly, antagonistic, and suspicious. And then lastly, we have neuroticism, which we know is how emotionally stable or unstable someone is. So people high in neuroticism are temperamental, worrisome, and pessimistic. And people low in neuroticism, or more emotionally stable, are maybe more even-tempered and calmer. Genes also influence our personality. One thing we look at with genetics is the trait perspective. That's our internal or genetic disposition to behave consistently across certain situations. The last thing we'll look at with the trait approach is how stable and changing our personalities are due to different factors. One of those factors is age. Changes in personality are much more frequent before the age of 30. A lot of this is because of development. If you recall in our human development module, there's a lot of new and existing ways we behave and different things we try out and go through to solidify our sense of self in our early teen years. So there's quite many variances. People also supposedly tend to become more conscientious, agreeable, and emotionally stable, and even less open to experience and less extroverted in adulthood. This isn't always true, though, for everyone. You might notice a lot of people tend to still be emotionally immature as adults in our culture, or some people don't tend to think about their impact on others. Usually people notice impacts of behaviors when it affects them, but if they're affecting one another, the awareness tends to be lacking a lot of the times. Gender is also another factor. Females are leaning more towards neuroticism, extroversion, agreeableness, openness, where males are leaning more towards assertiveness and openness to new ideas. And as we know, identity and gender identity can be fluid, so a lot of times what's happening is based on what's experienced because of the gender you identify with, it can have a big influence on personality development because you might experience positive or negative situations linked to your gender. Culture is another aspect, so personality changes very much depend on the culture you're in and expectations. For example, our culture values independence, which can create personalities a little more geared towards self-centeredness, while other cultures might value community and it creates personalities geared more towards conscientiousness. And then lastly is environment. There's what we call the person-situation interaction. So what we experience in situation to situation, our environment, influences how stable and constant our traits are. So we might display similar traits when faced with similar circumstances, but if they differ a little bit, we might get different traits popping up. So maybe we experience two situations that elicit stress, or you have two instances of conflict in a relationship and you'll respond in similar fashions to these, but there might be some variances because your response is based on the small differences in each given situation. Also, personality is both stable and changeable based on the environment. A great example is with kids. They might respond attentively, focused, and respectful at school, but maybe they get home and they're acting out. And at that instance, you have to look at what's going on in each environment that's eliciting this response, and even sometimes what's going on with the kiddo himself. Next, we'll look at the social cognitive approach for personality. So this looks at how personality is influenced by the environment socially and your thoughts, your cognition. So we have Albert Bandura's reciprocal determinism. In reciprocal determinism, he's saying that your personality is much more than just your internal factors. It's actually a product of three interacting forces, so cognitions, behaviors, and your environment, and how they interact with each other. And so your cognitions will be attitudes, thoughts, beliefs, expectations. Behaviors, your actions, choices, verbal statements you make. And then your environment will be the physical setting you're in, consequences, resources that may be available to you. And it goes beyond this, though, where we also influence our environment due to our behaviors and cognitions, which then will influence other people. A lot of times in this approach, you'll get various cycles, both positive and negative. Positive cycles would be maybe you're part of a friend group who communicates well, so no one feels left out, especially because everyone makes an effort to get together as a unit on a frequent basis. So everyone's influencing each other in a positive way. But then maybe you enter the next year of school and a new person gets added to the group and they struggle with existing in a larger friend group because they're shy. So the dynamics start to shift because this individual is focused on reaching out to individuals within the friend group and spending time in a one-on-one manner. But that might start a cycle where communication breaks down, and then people find themselves feeling left out, and then they may respond by criticizing others or pulling away. You also see in this that we may overgeneralize things or find something normal because we don't have other cognitions, behaviors, or environments informing us otherwise. This actually happens a lot in childhood. An example is I actually grew up in an Amish and Mennonite town in Pennsylvania, even though I'm neither Amish nor Mennonite. But I thought everywhere were farmlands and horse and buggies when I was super, super little until I saw other places. A lot of us also have instances from childhood, positive or negative, that we thought were normal because it's all we knew at the time. And until we experience something different, we don't know any better. You do see this with adults as well, especially if they're socially isolated, have never traveled much, or there's a lack of variety in their developmental and life experiences. The last thing with reciprocal determinism is self-efficacy. So that's your expectation of success in a given situation. You usually obtain this through interacting forces such as what you think about yourself, the world around you, whether the environments may be set up for success or failure, and what you get praised or demeaned for, and so forth. Higher self-efficacy, though, is associated with increased confidence, and low self-efficacy is usually associated with lower self-confidence. We then look at Julian Rotter's locus of control and a sense of internal and external expectations. So locus of control is how much control we expect to have on an event or an outcome. And control can be perceived as us internally having control or it being outside of us. So that's where you get the internal locus of control. It's the outcome attributed to factors within our own personal control. So people tend to have higher levels of confidence, self-esteem, better accountability, responsibility, and decision-making skills when they feel they have a good internal locus of control. With external locus of control, that's where the outcome's being attributed to factors outside of our control. So people will tend to develop a sense of helplessness and sometimes become reliant on fate when you see that you're perceiving control outside of you. Obviously, expectation of control does affect our differences in personality, as you've seen, and it's usually good to have a mix of both internal and external locus of control, though, because you're able then to recognize your own competencies and capabilities while also acknowledging what outside forces may assist in success or failure, or whether that is people, places, or things. In this way, we basically start to develop a healthier sense of what we call optimism and pessimism. We're now going into the humanistic approach, so this will emphasize that our individual personal choices and free will shape our personality. And it says we have this built-in drive towards fulfilling our own natural potential, and that is what is called self-actualization. Abraham Maslow and his hierarchy of needs makes yet again another appearance with this. And as we know from our earlier module from chapter 5, this pathway to self-actualization forms this triangle or hierarchy of needs where your physical and biological needs are at the bottom, the psychological, social needs are more at the top, and will basically behave the way we do based on the needs we're trying to meet. So we have our personal will and free choice allowing us to choose what we want to do and how we want to get certain needs met so we can progress forward. But like we noted earlier, this theory doesn't really provide any reasons for why we might forgo biological needs and aim for a social need instead, as opposed to just following the hierarchy. Next, we look at Carl Rogers and self-theory. So in this theory, we have what's called the actualizing tendency. That's that built-in motive to strive towards fulfillment and enhancement. And we also have self-concept, our perception of our abilities and uniqueness. Our self-concept varies as we age based on experiences, human development, so how we physically appear, what environments we're in, how we work through our stages of development, hobbies we engage in, the work we do, and so forth, make this up. We do have positive self-concept, so that can lead to increased confidence and self-worth, whereas negative self-concept leads to low levels of confidence and low levels of self-worth. There's also the organismic valuing process, which says experiences that maintain or enhance us are of values, while those that don't get rejected. We all have what we find of value and what we reject based on our various motives. So, what we find important, our goals, and so forth. A lot of times I'll say, think of therapy as this for an example. Some people view it as something that adds value because it enhances the quality of their life, and they sought it out because their self-concept was negatively impacted by something. While others might find therapy superfluous because their self-concept isn't being negatively impacted by something, or it's not impacted enough for it to be problematic in their eyes, so they'll just reject it. And then lastly, we have unconditional positive regard. So this is acceptance and love with no strings being attached. Conditions are not being placed. This does not mean, though, that everything we do must be approved or accepted. We will do things in life that are just not okay, and it will naturally result in certain consequences. What this speaks to is that when acceptance is offered, children and adults can come to accept themselves without distortion. And when conditions of worth are communicated, self-concepts start to become distorted and lean more towards the negative side. So for example, you're in a relationship and your partner is only affectionate towards you when you do chores or something for them. Or as a child, you got a bad grade and your parents tell you you're not smart and you're quote unquote bad. Then conditions are being placed on your worth. Now, if you're in a relationship and your partner shows affection even though you forgot a chore, or your parents communicate to you that they are upset about the bad grade, clarify why there are consequences and work to help you find a solution for the next time, then those are moments where your worth is not solely dependent upon what you do or produce. In both instances, someone might be upset, but they still view you positively. And that's where you can hold someone in positive regard while feeling the contradiction of negative emotions. Now we'll look at scientifically measuring personality, which there's quite a few ways to do this. And it's good to keep in mind that when doing any scientific measurement, we do want to ensure reliability and validity of it. Reliability is that degree to which a test produces consistent measurements over time. And then validity is the degree to which a test actually is measuring what it's supposed to be measuring. We'll start with some common personality inventories, which are these self-report tests that are very reliant upon an honest and accurate self-report. You have the MMPI-2, which is the Minnesota Multiphasic Personality Inventory, and that looks for problem areas of functioning in personality. This one is good for when you want to do some additional assessment on some mental health disorders like bipolar disorder or personality disorders. Plus, you can track any changes over time as a client or individual retakes the assessment to see how they're doing or if something else is going on. And then we have the CPI, the California Psychological Inventory, which is looking at positive traits in healthy individuals. So this one's used a lot in work-related settings to help get a sense of someone's leadership or potential for performance, and maybe to see what types of development programs a workspace might benefit from. We then have what we call projective tests. So these are where someone is shown this ambiguous stimulus and they have to describe what they see. These tests are thought to reflect some sort of underlying unconditional urge or desires, so things that are repressed or forgotten. And it comes from our psychoanalytic perspective with the different levels of consciousness. It's very much open to interpretation, and usually when you use these, you can start to identify themes or patterns in someone's life, and it delineates an individual's problem-solving style. So you'll be able to kind of start and see how they might go about solving problems based on what you're asking them to describe. Two common types of projective tests are the Rorschach inkblot test and the thematic apperception test, or TAT. The Rorschach inkblot test is the one we all, I think, have heard about, where you're shown those 10 ambiguous ink blots, and a person will describe what they see. And then the thematic apperception test is where you'll look at a picture and the person will tell a story about the image on that picture or on that card. And in both instances, the responses are looked at for themes or different emotions or potential underlying issues that arise. So a lot of times what will happen is someone might be describing things that are similar to death, or maybe they're describing things similar to a specific trauma. And that's because usually what is described is dependent upon past influences or even past experiences, and you can see how that will influence the present in an unconscious way. The last type of inventories we'll talk about are rating scales, direct observation, and clinical interviews. With rating scales, their format is very similar to a checklist where a statement's provided and then you'll check the statement that best applies to you. So usually it's like a Likert scale. You'll choose on a rating of 1 to 5, for example, whether it's strongly disagree or strongly agree. And others can actually take these rating scales on your behalf to help minimize any sort of distortion that occurs when you're answering it. This can be beneficial when people are seeking treatment for a mental health concern, as an example, because it'll provide other perspectives that tend to be more accurate and you get a bigger picture of what's going on. I've also had clients take rating scales before, and if they're minor, I'll additionally have their parents fill out one on their behalf so I can see where they align or disagree on their answers, which then requires further investigation, and you can start to see what's being misunderstood, missed, and whatnot. Some rating scales are the Big 5 inventory, so that'll measure those Big 5 traits we discussed. There's also the Myers-Briggs Type Indicator, or MBTI, that looks at the 16 personality types based off of the source traits. There's the Personality Inventory for DSM-5, which looks at personality dysfunctions in adults. And there's also the Basic Personality Inventory, or the BPI, that looks at psychopathology as it relates to personality, like depression. We also have direct observations, and that's where we're observing clients or patients to assess their personality. This is usually done during sessions, interactions, assessments, or appointments, where you might be testing for something, and observing someone can indicate underlying issues based off of what you're noticing or looking for in their behaviors. For example, a person might behave aggressively and defensively when you're asking them questions about their childhood, and that could indicate a trauma or an experience that they're not wanting to recount but is obviously impacting them. Sometimes you'll start to notice themes from what someone is reporting, such as how they handle conflict. Other times you might actually be doing a formal assessment to test for ADHD or autism, for example, and that has certain behaviors that you're clearly looking for the patient to exhibit. Someone sometimes can come into these appointments with hygiene and memory starting to slowly decline. So you're observing that, and that could indicate something else is amiss or occurring. Or if you're in a psychiatric hospital or a treatment facility, the staff will also observe the clients there to see how they're interacting with one another, because it can be very telling of how well treatment is going. And then lastly, we have clinical interviews, and it's used by most mental health professionals, where you're directly asking clients questions to identify their difficulty in functioning. This is usually what I do because of my profession as a mental health counselor. So when we first get a client, we start by having them complete an intake form before the first session. And this asks clients about why they're seeking services, past trauma, medications they take, past mental health history, relationships with friends and family, medical conditions, mental health or medical conditions that run in the family, suicidal, homicidal experiences or ideation, and so forth. It's really packed with information, but this is so we can first identify any past issues that may be impacting why they're coming to therapy, how the present issues impacting their life, and then any potential issues that could arise. In the first session, we'll then discuss these concerns, and based on what the client brings up, we usually have specific questions we want to ask them. I tend to ask a lot of questions in all my sessions so we can keep progressing, and then there are certain points you do check-ins about certain things, but usually from what gets reported and what you observe, you can tell things how well things are moving along. And that concludes our lecture about personality.